Good evening from the nation's capital. I'm Kelly Wright. Glad that you could join us as we spend this next hour together. And as always, I do hope that you are safe and well, taking care of yourself and your family. My opening observations, I'll get right to it. I'm standing in the executive office building at the White House. The reason for that is that the president and his team that deals with the coronavirus pandemic is actually striving to do things that will bring us all together. The slogan being, we're in this together. As many of you know, there have been mixed messages going out, not only from the president, but also from other people throughout the Congress. And as a result of that, many people have politicized things like wearing a face mask. But the bottom line is, as John F. Kennedy once said, ask not what your country can do for you, but what you can do for your country. So it really begs the question, what are we doing to help each other get through this COVID-19 pandemic? So we're here at the White House to listen to members of the Trump administration explain what is being done from their standpoint and what we all can do together. And those are my opening observations. The number of U.S. COVID-19 cases continue to rise. On Tuesday, 60,000 cases were reported. That is the biggest single-day rise since the start of the pandemic. Ambassador at Large, Dr. Deborah Birx, is the coordinator of the White House Coronavirus Response Task Force. Ambassador Birx and I discussed the rise in COVID cases, and we socially distanced ourselves as she explained what must be done to deal with the rise in coronavirus cases. Dr. Birx, thank you for appearing on the program tonight. And one of the questions I wanted to ask you is, where are we in terms of really dealing with this coronavirus? Because it's impacting so many Americans, especially after the Independence Day weekend, where we saw a lot of people not practicing safe distancing.
Yeah, I think we sort of understand what happened after Memorial Day and that time between Memorial Day and July the 4th, and really understanding where the infections have moved. And clearly the infections have dramatically expanded in the under 40 set. And this is from a whole constellation of reasons. I think the biggest reason is most of them are asymptomatic, and so they don't even know they're spreading it to one another, and they feel well. And I think really being able to get messages to them about what we need to do as a community of Americans, from wearing masks 24/7 if we're in public, social distancing, washing hands, but not moving from, when we close the bars, it doesn't mean that you go into someone's house and have the same bar-like scene with multiple individuals. And I think really calling on everyone to make sure we're continuing to protect those that we know have a very rough course. We now see a lot of 20 to 45-year-olds being admitted to the hospital that have pre-existing conditions, and I think out of respect for them and respect for people that may be older with pre-existing, what do I mean by pre-existing? Chronic diseases, right, like diabetes, obesity, hypertension, heart and lung disease, renal disease, all of those things that we know give people a much more difficult course, to make sure we're protecting them and protecting each other by doing those common sense pieces of wearing a mask, socially distancing.
This coronavirus, as you know, has had a dramatic impact disproportionately on Black and brown communities. What can we do to stop that and also help people who are confronted with health disparities?
A really important question. You know, I've spent my life working on inequities around the world, and so to see that in the United States, to see communities at really an increased risk for multiple reasons, not only the health disparities, but also the fact that many of them were essential workers and were out serving us the entire time so that others could stay home. Many of them are working in hospitals. Many of them are making sure that we could stay home. And I think the third part of that was multi-generational households. And I think I love multi-generational households. I'm part of them. I have grandchildren from 1 year old and my father who's 96. But that makes a much more complicated picture when you're trying to protect others that you know could have a very severe outcome. And then you add to that incomplete messaging about the amount of asymptomatic spread. And so there may be young people in the Black and brown community who don't know they're infected. And so really increasing testing through our federal clinics into the cities and into those communities that may have less access to testing, and then setting up our testing sites and testing availability, because I think everyone wants to know their status because they want to protect others. So in addition to wearing your mask and socially distancing, if you're under 40 and you've been in a group setting where you may have been out with others, go and get tested within the next 5 days.
Do the numbers still show that blacks and browns are 3 times, 4 times likely to know someone with COVID-19 who has had it, gone through it, and maybe even susceptible to it themselves? And the death rate, are they still leading in the numbers of those who have died from coronavirus?
So the major wave of mortality happened in the March, April, May timeframe, when this virus really hit the Northeast, Chicago, Detroit, and we didn't have all the tools that we have today. So even though mortality may be stable, we still have high infection rates, and I think that's really key that everyone understands. The mortality may continue to go down, it may stabilize, but that's not a reflection on the amount of viral spread, and that's why we really tell people to watch test positivity. And it's our job to get into every Black and brown community and make sure they have equal access to testing and information, and I think that is really key. When communities have the information that they need, they can protect themselves. And I was really inspired when I was out in Arizona. I've been on the road to really see for myself what was happening on the ground, because I think that's invaluable. I met a Black woman from Arizona that was leading a Black African American task force on COVID and was providing every 2-week information into the community and a newsletter and a website. This is what we need to have in every community: informed Hispanic leadership and informed Black leadership, so that we can get that information out in a real way to a community that resonates with communities and resonates with young people in communities, which is always difficult.
Your colleague, Dr. Anthony Fauci, says that we are knee-deep in coronavirus. Do you agree with that assessment? And if so, what can we do to mitigate it?
So, pandemics are local. We like to look at it as the United States, or we like to look at it as a state level, but we really have to look at it at the community level. And so across the South, except for New Orleans, they were able to actually control the epidemic. They went into lockdown. No one had an experience like New York or Boston or Philadelphia or Chicago. And so when cases started to tick up in some of these communities, they thought it was more like the outbreaks that they've been containing all along. The outbreak in a long-term care facility, the outbreak in a prison, the outbreak in a specific workplace. And they thought they could contain it. But somewhere along the line, those outbreaks changed to significant community spread. And so we're very different across the country. I believe now the governors and the mayors are implementing the right pieces to actually control this across the South, with mandating masks, with mandating social distancing, with closing of the bars, and really communicating to all communities of what we need to do as American people, as an individual level, what the state and local governments need to do, and what we need to do as a federal government to really control this community spread.
Welcome back to the program. We're taking you back now to the White House at the Executive Office Building, where I interviewed not only Dr. Deborah Birx, but also the Surgeon General, Jerome Adams. He is the 20th Surgeon General of the United States. His mission as the nation's doctor is to advance the health of the American people. And his motto is better health through better partnerships. Here now is my interview with the Surgeon General. So Surgeon General Adams, this coronavirus has had a disastrous impact on the African American and Hispanic American, Latino American communities, as well as Native Americans. These disparities, how do you address that, and how do you move forward in mitigating the spread of the virus?
Well, I am deeply concerned about that as Surgeon General, also as a black man. I have prediabetes. I have high blood pressure, two of the major risk factors for COVID-19, and I have elderly parents at home who I'm always on to stay home. My dad likes to get out and socialize like many parents do. And I'm telling them when they do go out to make sure they wear a face covering. Most important thing I could pass along to folks is that we have some degree of control over the spread of this virus. And that's by the actions that we take. We need to make sure we are staying home whenever we can, but when we do go out, that we wear a face covering and we try to maintain at least 6 feet of social distancing. That doesn't take away from the fact that we have a tremendous responsibility as public health officials and as a government to make sure people have the opportunity to make healthy choices. We know that COVID has really preyed upon many of the pre-existing disparities that have existed in this country for 100 years or more. When you look at the impacts of bias and racism, when you look at the social determinants, what we call them, of health, like inequitable access to transportation, good paying jobs, safe and affordable housing, all these are important to making sure everyone has the best chance at a long and healthy life.
Now, I know as Surgeon General, you're concerned about all members of American society. Are we getting the message out there in the right way, or is there mixed messaging coming from the science as well as the politics? Why have we fallen into a place where it seems to be a political problem if we wear a mask?
Well, one of the challenges is that the COVID pandemic started in the midst of an impeachment trial, and we are now in the middle of an election year. So we are always trying as public health officials to keep politics and health separate, but in some ways they're inextricably linked. Here's what I want people to understand. The science tells us that this disease is here. We're going to have to be dealing with it for the foreseeable future, at least through when we get a vaccine. But there are preventive steps that we can take right now. I have a PSA and a campaign out, COVID Stops With Me, helping people understand the steps that they can take to slow the spread of disease. We also need to understand we're in a very different place than what we were just a few months ago. We know more about the disease. We know who's impacted. We have more resources, such as remdesivir, steroids, and convalescent plasma. We have more supplies available to help folks respond in over 40 million tests. So it's not to say that it's mission accomplished, but it is to say we're in a better place to respond. We need to do a better job, quite frankly, and that's on me and all public health officials, of engaging with communities and helping them understand their risk and helping them make informed choices about doing the things that will keep them safe.
Duly noted. How do we get testing and contact tracing, as well as the vaccine, if and when it becomes available, because we don't know when, into those communities that are already hard pressed, those marginalized communities, those communities of color?
Well, one thing I want people to know is that testing is available free in many locations across the country. We've opened up over 600 community-based testing sites that we specifically put in places that have a high social vulnerability index, meaning people with lower incomes, people who have different risk factors for poor outcomes, and disproportionately people of color. We've also dedicated over $25 billion to community health centers and to Medicaid providers, which we know disproportionately serve people of color. So testing is available. We want you to know it's free. We want you to know if you go into the hospital after being diagnosed that actually we will reimburse the hospital or providers for your care, so that you should not get charged for your care. We don't want there to be impediments. But you mentioned vaccines. Less than 50% of adults got vaccinated for the flu last year. That number is even lower in black communities and in brown communities. I am terribly worried that we actually get a safe and effective vaccine in record time, but disparities worsen because the people who need it the most can't get it or won't get it. So we're reaching out to communities now, as I always have been, trying to help people understand that vaccines are safe and effective. We really want people to get their flu vaccines this year, because you don't want a flu season really bad on top of a really bad COVID season, but also helping them understand that if the COVID vaccine gets developed, we need to make it available and people need to take it.
I know you got to go. Your reaction to the Atlanta mayor, Keisha Lance Bottoms, testing positive for COVID, as well as her husband. I mean, it shows that public health officials are not immune to this virus.
Well, I was in Georgia just last week, And it's important for folks to know that no one is immune to this virus. Anyone can be exposed to it. But it's also important for people to know that there are steps that we can all take. COVID stops with me. COVID stops with you. Wear a face covering. Wash your hands frequently. Stay at home if you can, because if the mayor of Atlanta can get COVID, any of us can get COVID. And I do want to say that my prayers go out to her and to everyone who's been afflicted by this disease, and I'm hoping that she recovers well. I heard she was asymptomatic. Important for people to know that most people who are spreading this disease now are spreading it without knowing that they have symptoms, and that is why we encourage people to now wear face coverings, because you could be spreading the disease and not even know it. So kudos to the mayor for getting tested, for being open about it, and for helping spread the word that this can happen to any of us, and it's why we all need to take precautions.
You're watching The Kelly Wright Show. We're coming back with more after the break. Welcome back to the program. So my next guest is Seema Verma. She is the administrator of CMS. That's the Centers for Medicare and Medicaid Services. In that role, she oversees one of the largest federal agencies that administers vital health care to so many millions of Americans. She also directs a $1 trillion budget in that capacity to provide health care coverage for more than 130 million Americans. Here now is Administrator Verma. When we look at the spread of COVID-19 cases and the fact that it's growing in senior citizen communities, how does that impact the cost of Medicaid and Medicare, particularly for those who rely on it?
I think it's important to know that at CMS, we are serving America's most vulnerable populations. That's our Medicaid population. That's often our age, blind, or disabled children, pregnant women. And then our Medicare population is our senior. And we also serve individuals in the exchanges as well. So our populations are vulnerable to begin with. And what we've tried to do at the federal level is to make sure that those programs are flexible, that they're doing everything that we can to make sure that people have their needs taken care of. So that starts with testing, making sure that co-pays, things like that are waived, and that people can go to different locations and get the testing that they need. We've also worked to waive co-pays, not only for testing, but also for treatment as well, giving our plans in the seniors plans and our Medicare Advantage plans to make sure that they don't have those extra burdens in Medicare Advantage of cost sharing as well.
And for the doctors and hospitals that you're paying, many of them would argue that you're not paying them enough. Do you think that they will care enough for those Medicaid and Medicare recipients?
Well, one of the things the administration has done and the president's been focused on is making sure that our healthcare system remains strong and able to address the rapidly changing needs of their communities and populations. One of the things that he did was sign the CARES Act that put $175 billion into the healthcare system. So some of the financial concerns that our healthcare system has faced, because they have increased personal protective equipment that they're having to pay for. And we know that many of them haven't been able to perform essential surgeries and services, and so that's why the president's been focused on making sure that they have their finances dealt with so that they can focus on making sure they're providing high quality care to their patients.
I'm curious, what are your concerns about those who are relying on Medicaid and Medicare and they have nowhere else to go and they're not getting the care they need because of the system being overburdened because of COVID-19? We've seen a spike in cases. That means just a routine doctor's visit could be problematic for people living in these kinds of communities who are dependent on Medicaid and Medicare.
Well, you know that I think what the coronavirus has done is expose long-standing issues that we've had, whether it's healthcare disparities or just access to care. So one of the things that we focused on is to try to focus on those administrative barriers, those regulations that stand in the way of patients being able to get the care that they need. We have waived probably hundreds of Medicare rules and Medicaid rules to make sure that these programs are more flexible so that people can get the care that they need.
That's so important, and to the people who are watching this that may be relying on Medicaid, may be depending on their Medicare, what's your advice to them in terms of what they're dealing with and how do they grapple with this coronavirus and the other issues that they're faced with just through the sheer number of health disparities and some of the problems that they may have already?
I think it's very important for people to prioritize their health and to make sure that if they're showing symptoms, if they're concerned about it, that they access the healthcare system. What we should know is that there are programs in place to help people. We're seeing a lot of people that are now applying for the Medicaid program that haven't before in the past, and we've made those rules a little bit more flexible for the state so that people can apply, they can get onto the programs in a much more easier way to be able to do that. But it's, we want to make sure that people are getting the care that they need, and so they should feel comfortable knowing that they're, if they're worried about cost, if they're worried about paying their bills, we focused on, even for people that are uninsured, to make sure if they have costs related to COVID, that those can be taken care of.
We'll be back with more of my interview after the break. Here now is Administrator Verma. The Black, Brown, and even Native American communities have been adversely impacted by this COVID-19, but now that it continues to spread and hitting younger people, does this place a burden on the Medicaid, Medicare systems?
Well, I think there's always been that, particular burden in terms of healthcare disparities. That being said, we're doing everything we can to support these programs. In the Medicare program, we've waived a lot of the rules, regulations. For example, so our seniors can get their prescriptions filled not just for 30 days, but a longer period of time so that they don't have to travel to the pharmacy. We're waiving those copays. One of the biggest things that we've done is make sure that telehealth is widely available to our Medicaid patients as well as our Medicare patients so that they don't have to travel to the doctor's office and that they can receive those healthcare services from their home. We also heard that a lot of patients weren't comfortable or didn't have access to a computer, and so we said, well, we're going to pay for audio services so that they can call their doctor over the phone. So these are very, I would say, historic changes, historic flexibilities that we've offered in the Medicaid program and in Medicare to make it work better for patients that we know that are already vulnerable to begin with.
Yeah, those vulnerabilities are a myriad of problems that they've already had, pre-existing problems, and now the coronavirus comes in. They're the most vulnerable in terms of the senior citizens, the Medicare recipients. Is there something that can be done to get the message across to young people to mask up COVID down?
Well, one of the things that we're reminding people of, and I've got, younger kids at home, teenagers and college-age students, so, one of the things that's important for everybody to understand is that anybody can be infected, whether it's a small child or somebody that's older. And we don't know the impact that it's going to have on individuals. So what we're seeing now is our younger population, people under 50 are now showing up in the hospital. And we also don't know who has the virus and who doesn't have the virus, because we do have something called asymptomatic spread. So somebody may have the virus and not even know it, and they could be potentially spreading it to other people. They could potentially spread that to somebody that is vulnerable, and that could have very serious and significant complications. And that's why our message is everybody's got to do their part. Wear a mask, wash your hands, and try to remain socially distant, because that's the key to keeping our economy open. As a mom, we want schools to open in the fall. And so as part of that effort, we all have to do our part to control the spread of the virus.
And another question for you is, how do you personally view this problem that we're confronted with? How do you personally put yourself into this coronavirus task force to help so many Americans in need?
Well, I think that from our perspective, and really every member of the task force, we're just dedicated to make sure that we are doing everything we can to support the healthcare system, to support people that are on the front lines, not only to help our beneficiaries, making sure that they have the information that they need. For our healthcare workers, we want to make sure that we're getting rid of regulations. We're making sure that they have the supplies that they need, and we're making sure that they have all the resources. So from our standpoint, it's working with a sense of urgency. We want to do everything that we can to keep America safe and to support our healthcare workers that are on the front lines.
And we're back with more after the break. Welcome back to the program. So we've heard from the White House. Now let's hear from a city council member in Los Angeles, of course, one of America's largest cities, and California, as you know, has seen a rise in COVID-19 cases. Council member Herb Wesson joins me now to talk about some of his preconceived ideas about what was going to unfold. In fact, he had sent up a warning flag, if you will, council member, about the fact that you thought that our response to COVID-19 was not on a firm foundation, and that states like California may have been pushing the limits by reopening too soon.
Well, there was a lot of pressure, I think, from the business community to open up. My concern was when you begin to reopen, the individuals that are going to be out in the workforce, for the most part, are going to be people of color, because of the type of work that we do as Blacks and Latinos. We don't always work from computers. The work that we do has to be out in the open. So my concern was about having the proper protective gear, making sure that we had some kind of mass testing so that individuals could find out if they were positive or not. And now what's happening in this state, in this city, a couple of the businesses that we looked to reopen, that we did reopen, we are now closing. We reopened bars and restaurants, and so now we're putting limitations on that. Every move we make now truly has to be driven by science. And I would just hope, I know I'm gonna always speak out to make sure everything that we do is science driven. It can't just be because of pressure from the business community to open up. I recognize how important it is to have work, to get money, but I can't think of anything that is more important or more precious than our health.
Sir, I couldn't agree with you more. In fact, I'm glad you stated that everything has to be driven by science, because the public health sector, they've been telling us and actually stating that this virus is airborne and people should just simply wear a mask. What's your message to younger people who have not worn masks? And in terms of the political division, what's your message to a lot of conservatives and Republicans who have sided with the president in not wearing masks? It just seems unconscionable to me that we're politicizing something that would safeguard our lives and our loved ones.
Well, I think we have a responsibility to do everything that we can to stay healthy. There are a lot of reports that would suggest that wearing a mask does help. There is not one report out that says wearing a mask doesn't help. So I would, err on the side of caution. And it is just so important that we do everything that we can to protect ourselves. We cannot allow politics to play in our dealings with this virus. This is, it's not like a flu that comes up every November. This virus we've seen in hundreds of countries, when it's very, very hot, when it's very, very cold, when it's raining, when it's dry. So this is something we have never dealt with, something we should take very serious. And I'm, for the most part, proud of the residents of this city. I think a significant percentage of them are doing everything that they can to try to protect themselves and their family. And I'm proud of that.
Thank you for that, Council Member Herb Wesson of the Los Angeles City Council, a city of 7 million people, the county itself 10 million people. You have quite a task ahead of you as we continue to try to mitigate the spread of the virus. Thank you for coming on the program tonight. And to your point, Dr. Deborah Birx, as well as the Surgeon General, have agreed with you that wearing a face mask is indeed very important and a necessary thing that we must do. Back with more of the program after this. Welcome back to the program. We're going to change topics a bit, and that is pertaining to the election. And of course, a lot of people are voting or planning to vote in this election. It's going to be a very huge in turnout. At least that's what many people are predicting, depending on how we can get through this COVID-19 pandemic and the disruption that it's causing. But Attorney Mark Harris joins us now. He's a civil rights attorney with the Ben Crump Law Firm. He's based in Sacramento. And a lot of people are looking at the great state of Mississippi right now as it pertains to possible Black voter suppression. Mark, tell me about that, please.
Well, let me tell you, Kelly, first of all, thank you for having me on your show again. It's a pleasure to be here with your viewers. A lot's going on, and this is the intersection of law and legislation. The reason I wanted to become a lawyer in the first place, Kelly, was because as I was growing up in South Central Los Angeles in the 60s and 70s, it was the lawyers who were on the forefront of social change. While folks were demonstrating, which was very important, lawyers were litigating. And I thought for me, that would be a career path that I wanted to follow. My family hails from Mississippi originally, and there was a Mississippi state law passed in the 1890s, which is still in effect today and has been legally challenged before the courts, finally on the ballot before the voters of the state of Mississippi in November. And what this voter suppression effort actually did was to set into Mississippi law a policy that said that in order for you to be elected to statewide office, you had to not only win a majority of the votes of your state, which is the way it is in every other state just about in the United States, but you had to win a majority of each of the 122 separate House districts in the entire state of Mississippi. That is absolutely Jim Crow era suppression intended to keep the African-American vote count down, and it's absolutely unacceptable.
So what can be done about this?
There are a couple of things. One, lawyers brought litigation forward last year, the end of last year into this year. It's before the federal district court in Mississippi, and the judge has asked for a pause on that case pending the outcome of this November's election. The political leaders in the state of Mississippi, much like Stacey Abrams, the great Stacey Abrams is doing in Georgia and throughout the rest of the country, the political leaders in the state of Mississippi qualified a constitutional amendment, a change on the Mississippi Constitution to do away with this provision requiring that in order to be elected statewide, you had to win a majority in each of the House districts throughout the state. What this means, Kelly, when you stop and think about it, if Kelly Wright were to be elected any state office, governor, lieutenant governor, attorney general, treasurer of the state of Mississippi, you not only had to win 50% plus one vote of the popular vote of the state, but you also had to win a majority in some of the most racist and segregated districts in the country. That is absolutely ridiculous, and it's why there hasn't been an African-American statewide elected legislative leader for quite some time. In fact, probably since Reconstruction.
Well, I thank you for bringing that to light and to let us know what is being done about it. What role can people outside of the state of Mississippi play in order to influence the change there, just as we saw a change because of the protests in the wake of George Floyd, caused Mississippi to take down its Confederate flag and some other things that are taking place there in the state like this now. What can people outside do to influence the state?
It can support this effort financially. It can support this effort in terms of the greater Get Out the Vote campaign that's going to occur in November. I don't care who people vote for. I'm not partisan when it comes to voting. I'm practical. Whoever your selection is for election, cast your vote, have your voice heard. And I think that Mississippians will take that to heart, but the rest of us can support those efforts through the internet. We can go to the websites that are supporting these efforts. We can follow what Stacey Abrams is doing. She's doing amazing work in ferreting out voter suppression, particularly Black voter suppression throughout the country. So there's a lot we can do from our homes, Kelly, wherever we're located throughout the United States and the world.
All right, Mark, and one other question I'm going to bring up, and that's changing the topic just a little bit. Charges being filed against the Central Park Karen. Tell me about that with Amy Cooper, because I understand that the Black Bird Watcher has not been cooperating with police, yet charges are being filed against her.
this is a complicated case. You know, it's not as simple as people think. I admit that when I first heard about the facts, I was outraged. An African-American man who was merely trying to make sure that the law was followed in Central Park. This was about the most innocent guy who could be walking through Central Park at the time. He's an African-American, older gentleman. He's not a young guy by any stretch of the imagination. He's seasoned, as we say, Kelly.
Yeah.
A bird watcher. I don't know any other black bird watchers. Turns out he's Harvard. It turns out he's Harvard educated, and a very calm spirit from what people said. He tells Amy Cooper that her dog is disturbing, quite honestly, the birds he's attempting to watch in Central Park. And this event is occurring right in front of a sign that says that dog walkers must leash their dogs. They must have their dog on a leash in Central Park. And she goes ballistic, as we've all seen. The most troubling aspect of this, Kelly, as we know, is that it happens so often that we've nicknamed it acting like a Karen. And acting like a Karen depicts an entitled Caucasian female who professes a certain level of liberal, progressive thinking until that person is pushed and annoyed in some way. And what this woman did was she called law enforcement on this African-American gentleman. She changed the tone of her voice to sound more like a victim. And we all know the rest. We saw it depicted in countless news articles and on social media. The troubling part of this is it's very clear that what she did is against the law in New York State, that she should have been first arrested or at least cited. In this case, it's cited. It's a misdemeanor. She should have been cited and there should have been a proceeding against her. Cyrus Vance, who is the district attorney in Manhattan, the son of the former Secretary of State, dragged his feet on this for weeks. And only just now, after much pressure has been mounted against him, has decided to go forward. The victim of this is the African-American community. The victim of this is the next gentleman or woman who walks through Central Park who's African-American, who's falsely accused of something like this because another Karen does the same thing with impunity. So I hope that District Attorney Vance will do the right thing, prosecute this case, bring the full extent of the New York State law down upon this woman, Ms. Cooper, and let the facts be what they are and let the results be what they'll be.
Attorney Mark Harris, thank you for joining us today, and we'll be back with you tomorrow to talk more about something else that's going on, that's police reform. So be sure to everyone to tune in to make sure that we can hear from Mark Harris on his perspectives on police reform. Mark, thank you for tonight. Thank you. Appreciate you.
Love being on your show, Kelly. Thank you.
Back with more after this. Welcome back to the program. So I'm joined now for Strengthening the Family, #FamilyStrong, because we must keep our family strong, even in the midst of this COVID-19 pandemic. George and Tondra Gregory, they're the founders of Journey for Life, as well as they serve as NFL chaplains for the Los Angeles Chargers. They join me now to talk about what do we do when we come up against conflict? How do we resolve it in a peaceful manner within our families and outside of our family home? George and Tondra, good to see you guys.
So good to see you,
Always
Kelly.
good to see you, Kelly.
Yes. Go ahead.
No, I'm sorry. As we strengthen the family, what do we need to do when it comes to conflict resolution?
Well, conflict is inevitable. If you are a part of a family or in any relationship, you're going to have a disagreement about opinions, or your rights might feel, violated, or, we have unfulfilled desires, then it produces conflict. So we just wanted to talk about what causes conflict and how do you handle it, right? Because conflict is an opportunity for growth and understanding to take place. Yeah.
Yeah, I mean, like she said, I don't know any family who doesn't have a little conflict, or even if we look at what's going on in our world today, the smallest thing can be a conflict to the biggest thing. And what we learn as we go throughout America teaching on subjects like conflict resolution is that we know this: if you want it your way, you got to go to Burger King. because conflicts happens a lot of times when our needs are not met, right? When we have expectations, right? How many times have we had expectations, and when they're not met, then all of a sudden we realize that, man, we feel a certain way about those things. And so we call this that you have to be assertive, right? You have to know how to say what your needs are. And you have to, meaning Tandra doesn't just get me, right? There's so many spouses we say, oh, our spouse should just get us. Sometimes we don't. We have to give each other the cheat sheet. And we call that being assertive, right?
Yeah.
We have to be assertive. We have to understand that when our needs aren't met, we have to say, instead of getting mad, sometimes we just have to say, hey, here's a need. Here's how I'd love for you to fulfill that need within our relationship.
So, George, how do you get to that place called peace?
Well, peace is the name of our organization is called Journey for Life. Sometimes you find peace at various points on your journey, meaning you'll stumble upon it, but it's always there. I love the gospel. We're Christians, we're pastors, we're NFL chaplains, and the Bible gives us plenty of passages that gives us hope on our way. One of which is this one. It says, above all else, guard your heart. For everything you do flows from it. Now that's a key scripture, right? Our heart can be offended, but if we guard our hearts, offenses will come, but if we guard our hearts, even in the midst of offense, we can walk in peace. It says that everything that we do flows from it. That's why it's so critical that we watch and we pray and that we read our word and that we act and do what God is asking us to do. And I know this show is not a religious show, but when this principle comes, it just shows that we are in charge of guarding our hearts. It's not the other's part to guard our hearts. It's our individual parts. And as a family, when everybody's guarding their heart, we think we can get along much better.
So you take care of each other's hearts, and that therein you find a resolution to the conflict until the next conflict comes along. You do realize that what you're talking about that takes place in the home is very apropos to what's going on in our society today. With this pandemic, with the racial divide and political divide. Certainly, if we can apply this at home and guard our hearts at home, we can try to mirror it and model it outside of the home. Is that right?
That's right.
That's right, because that's where we learn how to resolve conflict is in the home.
If you like what we're doing in terms of strength of the family, make sure you let George and Tandra know. Hit them up on their social media pages. And where can we find you guys real quickly?
Yeah, on social media, it's at Journey for Life Now, or you can go to our website at journeyforlifenow.org.
All right, don't hit them up, love them up.
Yeah.
Love you guys. We'll see you back with more on Friday as we continue to reach out to strengthen the family. George and Tandra Gregory, Journey for Life and NFL chaplains to the NFL team Los Angeles Chargers. God bless you. Back with more of the show after this.
Thank you.
Welcome back, and now for my final word as we close up shop here at the White House. I want to thank the White House for, one, having me here, and then I want to thank you for watching us. I do appreciate you watching every night. As always, I hope that we've learned something and we've dropped some good knowledge on you, some information, and some thoughts on what we can do to fight this COVID-19 pandemic together. Bottom line is, hopefully you've been united and ignited to not spread fear, not spread hatred, not spread racism, but love, freedom, and peace. Good night.
It's easy to find if you're listening. The color of light.